So if emergency dentistry is so great, if 50% of the population only goes to the dentist when it's an emergency, but only 1% of the dentists are willing to see those patients, why aren't you already doing emergency dentistry? Let me give you some of the top reasons that you're not doing emergency dentistry. Reason number one, it's a 24/7 job and you don't want to be married to your practice. If you really want to be an emergency dentist, you have to be available on call close to 24 hours a day. Emergencies don't only happen at 12 o'clock on a Tuesday. They happen at 3 a.m. on a Saturday, at 5 p.m. on a Friday, at 2 a.m. on a Sunday. They happen all the time. Patients are going to call in all the time. How do I know this? Because I own an emergency dental practice. We run emergency dental practices. I know when patients call. The highest call volume is typically Friday night through Saturday night. Those are the times when most dentists don't want to go see patients. So if you want to be an emergency dentist, you're going to have to be available close to 24 hours a day. Reason number two, you have to work on somebody else's schedule. So much like the 24/7 thing, you don't get to pick your schedule. If you think you're going to be working Monday through Friday from 9 a.m. to 5 p.m. or Monday through Thursday, you're not going to have that option. You might only see one patient on a Monday in those hours. Most of the patients might come in the evening. Next Monday, they might come in all morning long. So you're working on somebody else's schedule. As dentists, one of the best things is having that set schedule and knowing who's coming in, when they're coming in. With emergency dentistry, it's all over the board. You never know who's going to be coming in and calling at what time. So it's very difficult. You can't set your own schedule in that case. Reason number three, cost. It's expensive to run an emergency dental practice, and you're not going to make a lot of money off of those patients. Let's face it, emergency patients are not buying veneers and implants. They want a quick, inexpensive extraction. They want a inexpensive root canal. They want to get out of pain. They want incision and drainage. They want a prescription. They want easy, affordable procedures. Now, we're taught as dentists to try to upsell patients or try to get the highest value patients. Obviously, an implant is going to be a lot more lucrative than doing an extraction with nothing to replace that tooth. But the reality in emergency dentistry is you're going to be just pulling the teeth and not doing any kind of restorative care. So you don't get that crown and bridge, you don't get those implants, you don't get the big cases that you can get in a traditional practice. Reason number four is that it's very difficult to change the way your practice behaves. Right now, most people that advertise emergency dental services will see an emergency if somebody else skips an appointment or they have an opening in their regular schedule. You can't run your emergency practice that way and have any kind of real success. That's because you need to be an emergency dentist when it's convenient to the patient, not when it's convenient to you in your practice. So you have to make fundamental changes within your practice. That's why it's so difficult for many doctors to try to implement emergency services after hours or during hours, because the patient load is going to change all the time. And all it takes is one time for the patient to call up and say, I have an emergency, and you say, you know what, our schedule is booked all day today and I can't see you. That word will get around quickly and you'll never have that opportunity again. So those are some of the biggest reasons that you're not currently, and most doctors currently aren't really seeing emergency patients. It's great to market that you're an emergency dentist, but if you're not actually a 24/7 or on-call emergency dentist, you're not really an emergency dentist. And that's why so few doctors are really doing it. We've found a great model that's worked for us, and that's why we're franchising our model out. And if you'd like to learn more about the systems that work, how to keep costs down, how to see a lot of patients, and how to run an emergency practice outside of your existing practice, visit our website. I have the address on the screen. You can get more information, get our white paper, and a bunch of frequently asked questions right there. I hope this helps. I hope this drives you a little bit closer to helping those patients, those emergency patients that really need the help. I hope this gives you some of the answers you need, and I hope to see you on our website.